Each day at Baptist Health, we ask ourselves what we can do to bring our Kansans the most amazing care, when and where they need it most. And our answers have led to some amazing things, like the recent innovations in the Baptist Health Heart Institute. Heart disease is a leading cause of death for both men and women in the United States. And of all 50 states, Arkansas ranks 46 for fatalities caused by cardiac disease. To fulfill our commitment of offering the highest quality of care, exceptional service, accessible treatments, and greater value to our patients, we knew significant investments needed to be made toward innovative heart procedures, preventive services, and making cardiac care more readily available. And those investments are paying off. Let's take a look at some of the ways Baptist Health is bringing heart health and wellness to all Arkansans.
When it comes to complex heart failure care and for patients with end-stage heart failure, advanced heart failure, Baptist Health is the only place in Arkansas that supplies complete heart care with heart failure therapy, heart transplant, and all the support devices that's available. We have done between 250 and 300 heart transplants. We did 20 transplants last year, and our program continues to grow. In addition to all the other things that our program has available to us and that we've supplied to our patients since the inception in 1989 of our program, the thing that was lacking that we've gotten this year is the total artificial heart. The total artificial heart was an important step for us. It's a procedure where you take the patient's heart completely out and replace it with a mechanical device for supporting both sides of the heart. The patient's totally dependent on it. So it's a more complex procedure than any of the other assist devices that we do. But it's lucky that we have it because it's able to help those few people that have no other option.
It all started with Dr. West, cause at first he broke it down to me piece by piece. Then it got serious and he was there with me by my side and told me what could happen if I don't be compliant. So as I was being compliant, Dr. Hutchins came into play, and then Dr. Ransom came. And now, I'm still here because of them three. Doctor said, you gotta get an artificial heart. That's the last thing, that's life support. Or you can take it without the heart, an artificial heart, and you can be buried. So I chose to live because my little brother only 18, and I'm only 22. He don't wanna see me gone. And I don't want to be gone yet because I'm still young. So I chose the right way, and that's to still live. So it don't matter what pain, I've been through so much pain, I don't even feel pain no more. So I done went through all that pain just to still be here and be glad that I still in front of my little brother.
We started performing TAVR in Baptist Health in September of 2016. To this date, we have performed over 80 of these procedures with great success. Transcatheter aortic valve replacement, which is what we know as TAVR, is a minimally invasive procedure where we are able to replace aortic valves. Traditionally, this was only done with open heart surgery, and nowadays, as you can imagine, this revolutionized the field of cardiology. We're able to perform more efficient and effective procedures without having the whole process of open heart surgery. Nowadays, we're able to perform this even with what we call moderate sedation, which basically means that the patients are awake while we're doing these procedures, and it expedites the entire process. It is a very exciting feeling that we get when we see patients walking out of the hospital on the next day after TAVR, and we see them in clinic afterwards and feeling much better and with such a speedy recovery. Well, we had a 89-year-old gentleman that showed up to our clinic, and all he said was that he wanted to be able to dance with his daughter his 90th birthday. And of course, he was not able to do that before because of his aortic valve was not working properly. So we were able to perform TAVR on him and then watch him dance with his family and his daughter.
Well, he's just like a brother to one of the family. They told me it was going to be good, so I just trusted Dr. Rodriguez. He he could fix me up. I wanted to dance with my granddaughters at their wedding. Well, I got 3 more to go, so this better last. We just love Dr. Rodriguez, and like I said, we feel like he's part of the family.
One of the things that Baptist Health is doing to increase accessibility for our state is supporting and helping develop outreach clinics. And by doing this allows us to increase the exposure of the rural areas to specialty care especially. And these areas are highly populated with people who have increased risk for cardiovascular disease, with subsequent increased risk for death and mortality or morbidity as a result of that. Well, I think as all Americans, we want to make sure that everybody has access to the state-of-the-art care, whether it be subspecialty care or primary care. And because we know that cardiovascular deaths can be prevented, cardiovascular deaths can be decreased, increasing early exposure to cardiovascular care and screening is extremely important for these populations. One of the differences that we see by going to outreach clinics in Magee is that people now understand that they do have access to advanced care. And once you start with one individual in the family, that perpetuates throughout the family and the community. So now people understand, hey, you've got chest pain. The doctor's going to be here next week. What patients tell us when we go to these clinics is, hey, I'm so glad I didn't have to drive to Little Rock. It just makes my day not to have to travel all the way to Little Rock. Sometimes it's very difficult for me to get transportation to get to the doctor. So by you coming to the clinic here, it allows us to see you and allows us to have an opportunity to check on our hearts and make sure that we get the best possible care that's available. The best story is just someone coming up to you and hugging you and say, you know, thank you so much for coming here.
It's been a tremendous help for us in this community from a standpoint of providing that type of exceptional service that Baptist has to offer, and the fact that they come every week. People get familiar with them. People want to come back. Physicians are friendly. We've got quite a few patients we see on a weekly basis.
The Baptist health doctors that come here, it makes a big difference to the residents in this area because they don't have to travel very far, and they're so happy to see the Little Rock doctors here. Oh, when I'm sitting here, I listen to them talk, and just about everybody likes coming here because it's so much closer. They're just so proud to have him here. We are very thankful that the Baptist Hospital has decided to have these satellites here. We have different doctors coming different times of the week, and that makes a big difference to the people in this area. I love coming here rather than driving to Little Rock.
Baptist Health is investing time and resources into effectively improving the heart health of Arkansans. Through our innovative, proactive approach, and because of our commitment to being the most trusted healthcare partner in Arkansas, we are revolutionizing the landscape of cardiac care in our state and saving countless lives from the perils of heart disease. Each day, we at the Baptist Health Heart Institute strive to do one thing: be there for Arkansans with high-quality, innovative heart care when they need it most. The result is nothing short of amazing.